everyone, we will be today discussing about wound management with homeopathic medicines. I have with me Dr. Navneet Madan, who is a practitioner from Bangalore. We are recording this in Australia, and Dr. Madan is a professor of surgery from Bhagwan Buddha Medical College, Homeopathic Medical College, and he is also a professor emeritus from the Rajiv Gandhi Health University from Bangalore. So let's get started.
Yes.
So we'll first cover the wound management due to external causes.
See, usually wound may be a blunt injury or a cut injury or a fracture due to a severe impact. In these conditions, many times we use different medicines. For a contusion and all the general, as a general, for injury we use a medicine called as arnica, which helps in bringing down the pain as well as healing the wound. In severe knocks or nerve injuries, we use another medicine called as hypericum, which usually generally helps in nerve injuries, and also after effect of nerve injuries will be covered by another drug called as natrum sulph, which these things are, we leave it to the discretion of the physician. This is only a general information regarding the injuries. If there is a cut injury, sharp incised injuries, we use a different medicine called as staphysagria. And if it is an injury from a pointed objects, so we use another medicine called as ledum. So like this, depending upon the injury, we use different medicines. If there is an injury due to the overstretch, suppose while catching a ball, if a ball falls here and extends severely, and if the patient gets the pain, we give another medicine called as restox. Or if while catching the ball, if the ball falls on the tip of the finger and where the nerve endings are there and get crushed, then we use the medicine like hypericum. So these are all from the external mechanical injuries, we use different medicines. When these injuries get suppurated, sometimes they get into pus formation, and many times it leads to the general septicemic condition. We use a medicine called as acid carbolic and anthraxine, which can prevent the septicemic condition in the patients even when there is a diabetic wound. These are all only a general information, but the discretion to be given to the physician. Suppose there is a burn injury, either scalding or dry burn injury. First we have to stop the blebs and the burning of the patient, agony of the patient by burning. In such cases, we use a medicine called as cantharis or Urtica urens. And along with that, even another drug called as calendula, which helps in bringing up the granulation tissue in the burn wound and brings the normal, proper injuries, which I will show you some of the pictures in future, so that how the homeopathic medicines work when it is given from within, and also when we assist the nature to heal its damage on the body. So even in such conditions, when the injury, burn injury gets suppurated, even our acid carbolic will help in bringing down the suppuration and help in healing the wound faster. Sometimes, usually many patients will come after the treatment and first aid when the wound get healed, and after some time they come to us with the cicatrization or the contractures of the ligaments and skin conditions. Even in such conditions, we have seen, though not 100% cure, definitely there is a better improvement with the wounds when the drug called as causticum is given, and even the Wiesbaden, which is a spring water medicine made from the spring water, has the capacity to dissolve these contractures and bring them a better movement and better appearance of the patient. And also sometimes we have seen even the contractures where there is a movement of the joints are affected. Even in such conditions, Wiesbaden will help in clearing their ankylosis, what we call as ankylosis, will get cleared with the Wiesbaden. Even in sometimes if there is a mechanical injuries which is leading to the fracture of the bones, in such conditions surgery is necessary to fix the fracture. After fixing the fracture, our medicines helps in improving the fracture faster and also to reduce in many cases the post-operative complications. And even in surgical, because even if it is a surgery, it is nothing but a planned injury. Even in such surgical conditions, suppose let us say there is an abdominal surgery either by laparotomy or laparoscopy, the bellies, because the internal organs are meddled by the physician, the bellies will take care of that. And sometimes even after the injury of the ligaments, where there is a partial tear, where the patient is unable to go for surgery again, either economically or the general conditions, we have seen the drug like Gayakam has helped in improving the tear and also toning up the ligaments. And when there is an the accumulation of the fluid in the joints could be corrected with a drug called as Bovista. Many times injury happens 6 to 7 months back, or surgery is done 6 to 7 months back, but still the joint is swelling. That swelling of joint get cleared with the Bovista.
This is what we call remote effects. No?
Remote effects. Remote effects get corrected with the Bovista. And even because of that, when the stiffness of the joints are there, that get corrected with the Wiesbaden. Wiesbaden has the capacity to correct the ankylosis after injury. And many times even the bone fracture is there, we give a medicine called as Symphytum, which can correct, rather enhance the healing process of the bone. And also when there is a periostitis or periosteal injuries, the Ruta will take care of such injuries.
On the same lines, can we also talk about dental things as well?
In dental, usually caries get corrected with our medicine. When the caries started from the edge of the teeth and going towards the root, the drug called as creosote will correct it. When the caries is starting from the base to the teeth, edge of the teeth, the drug called as acid floor will help. And when the many times we have seen the patients are advised with the root canal treatment, but our medicine called as Theradion has the capacity to correct the root canal treatment. And when there is an impacted wisdom tooth, another drug called as Hekla lava, prepared from the lava of the Hekla mountain, has the capacity to correct the impacted tooth and make it straight without any surgery. Many times these impacted teeth are removed, but with our medicine called as Hekla has the capacity to correct and make it straight. Many times the doctors has the doubt that when there is no space, how the teeth can get erupted properly. We have seen in many cases the impacted tooth has almost turned normal and reduced the patient with agony, and there was no necessity of removing the last molar.
So there's also some things like the effects after dental. There's a lot of people would go to first of all they're afraid to go to a dentist, and then once there's mechanical interventions, they come back with pain, or they can come back with bleeding, or we also want to prevent any infection. So what would we do in those circumstances?
In such conditions, we have given arnica and also acid carb to prevent the further suppuration. But usual complication that we are seeing in most of the cases of removal of the molar, we have seen they put the retractors for longer duration, where their mouth is open for a long duration, and after the extraction, many have found they find difficulty in opening their mouth due to the TMJ, that is temporomandibular joint infection or the inflammation. In such conditions, we are seeing another drug called as alumina. Alumina with guaiacum has helped the joint to become normal, and they are able to open their mouth properly. And many times we have seen after an extraction of the molar, even the jaw has gone to the side. In such cases, alumina and guaiacum has brought them back to the normal position.
Just before we go into the wound management of due to diseases, I want to touch one last thing, and that would be there is the rubric which says ill effects of mechanical injuries, or surgery or whatever. So how do we? There's so many drugs like staphysagria and all that. Can we touch upon that, sir?
Yes. See, usually after the injury, we have seen after giving arnica, still the pain and swelling has persisted. And if you read your book, Boric, there is a drug called as verbena, which says it helps in absorption of the blood clots and alleviates pain from the wound. So after giving verbena, when the pain persists even after the injury medicines like arnica, or in incised wounds where we give staphysagria, or a pointed wounds like from prick where we give ledum, and even the blunt we give ruta or arnica. Even after these drugs, when the pain persists, we have seen verbena has brought down the complete relief of the complaint in the patients.
Okay, so with that, I think we have kind of comprehensively dealt with the subject of external wounds due to external injury. We'll now talk a little bit about the diseases or wounds because of the disease. And here's where I think, sir, the importance of regional expression of the disease is important as well, I think.
Yes. Usually we have seen the wounds which is not healing in most of the diabetic patients, or in varicose ulcers patients. Varicose ulcers, because of the lack of circulation and the congestion of venous congestion, the wound remains rather delays in healing, and in such cases we have seen the drug like Cordus marianus, which is due to the varicose veins ulcer, and with that, if there is a tendency towards the gangrene and if there is a blackish blood oozing out of the wound, even your Crotalus horridus, which is a snake poison, and if the whole leg is getting black and not healing, even in such conditions, a snake poison like bathrobes, where we give many times, we have seen in case of snake bites, when the wound started gangrenous, bathrobes has the deeper effect of correcting it properly. Along with that, with the bathrobes, we are seeing we give calendula, which helps in improve development of the granulation tissue, and also we give anthraxin along with that, so that it should prevent the further septicemic condition in the general system. And not only that, in the peripheral organs like fingers or toes, when the gangrene starts, we have seen by Doppler study, there is a less circulation towards the wounded part. In such conditions, the drug called as Squilla maritima, which has the capacity to improve the peripheral circulation. So, along with the gangrene medicine like Cicalcar or Lachesis or Crotalus horridus, or even from the tips of the fingers or toes, we have seen even Arsenicum album and Manganum aceticum has the affinity towards these organs. Along with the affinity organs, if we give the Squilla acts like a catalyst to enhance the work of the wound remedy by bringing the circulation to the area, and plus the anthraxin prevents further complications and septicemic condition in the patient. So with the gangrenous or the ulcer medicines, even so sometimes even when the wound is in the foreleg, we have seen the drug like jacaranda has the capacity, has the regional affinity towards the ulcers of the leg or wounds of the leg, have healed by jacaranda. And along with that, we have seen if there is any suppuration, the acid carbolic will help. If there is no suppuration, only wound is there, calendula help in bringing the granulation tissue. And along with that, we have seen by giving anthraxin, the wound healing period duration get reduced. So usually the homeopaths think that we should give one remedy at a time. But we have seen if you read the book, suppose if you while reading Lycopodium in Clark, he says with Lycopodium a dose of carboveg will enhance the work of Lycopodium. That is, carboveg will work like a catalyst to the Lycopodium. So same principle is being worked here also. So along with the injury medicine, by giving calendula, acid carbolic or Squilla, depending upon the need, we have seen the indicated medicine has worked faster and reduced the duration of suffering, and even the cure duration has shortened the duration of suffering and bringing the cure faster.
So that was very, it touched upon so many different aspects. One is, if you have noticed what I was talking, it touched upon very early signs of wounds, and then it went into stages of suppuration and then re-epithelialization. He also touched upon vascularization of some of the arterial and venous wounds. So there is touched upon quite a lot of things, including regional affinity. So can we also differentiate a little between dry gangrene and the wet gangrene? When there is lack of vascularization, it can lead to dry gangrene. So can we touch upon the differences between those two?
Yes, in the beginning of the dry gangrene, you will see the skins are becoming dry first, then leading to the dryness of the tips. See, when it is in in the skin, which looks like a callosity, the antium crude will help. If you read Calotropis in Clark or even in Murphy, he says it can increase the circulation in the skin. So Calotropis works like a catalyst along with the antium crude. In the complete gangrene, which is a dry gangrene, which is spreading upwards, is due to the lack of the circulation. We have seen along with arsenicum album or Cecal car, the Squilla maritima has enhanced the work of the dry gangrene medicines like Cecal car and arsenicum album.
So, is there anything particular? We also see a lot of rubrics of gangrene of internal organs, abdominal organs. So, is there anything specific that we have to look for, or based on regional affinity, or do we look at this similar gangrene?
One is similar gangrene drugs,
Huh.
because even when there is a gangrenous appendicitis, we have seen Crocus sativa, Crotalus horridus has helped. Whether it is internal organ or external organ, usually the gangrene tendency to be treated. To see the tendency, we have to see the family history also. Usually, as many times the wound get delayed when there is a family history of diabetes. In such cases, we have seen, along with the indicated medicine, if you give alpha, that has increased the action of the indicated medicine. Not only that, many times in other cases also, where even if there is no wound, but you are giving the indicated medicine, but still we see the improvement is not up to the expectation. And if we invariably see in such cases, if you see the family history, there will be invariably a diabetic case history, family history. In such cases, we have seen after giving a course of alpha or giving alpha along with the indicated medicine has shown its full effect.
That's interesting, because I would never have considered alpha. It's much more of a nutritive value. That's what we had
Yes.
thought of, and so it's acting as a supplement.
Supplement 1, here we have seen alpha because we don't write non-diabetic. We write diabetic known due to. When the diabetes is, because all will not go to the doctor with the name of the diabetes. One notices diabetes due to the sudden loss of weight, another notices due to the excess urination, another notices due to the blurring, another notices due to the delayed wound healing. When the delayed wound healing, the diabetes noticed due to delayed wound healing will be corrected by alpha. The alpha get indicated there. If you read Murphy, he says delayed wound healing also he says, and also he says the diabetic condition. So diabetes noticed due to delayed wound healing will get corrected with alpha. So when there is a family history of diabetes and your case is not coming around to your expectation, if there is an invariably family history of diabetes, if you give alpha and see, your indicated medicine will work fast.
So, are there any unique drugs that you have used for wound healing, like you were talking about Pyrara?
Pyrara, actually, it is used by one of my assistant doctor. Of course, I don't obstruct any of my assistant doctors when they do the experiment. So I usually say we give medicines on the basis of doctrine of signature. In one case of wound healing, when they had come to me after the bypass surgery, where they had opened to get the vein from the legs, the wound did not heal. Then they wanted to do the grafting. Since they were economically poor, when they had come, when I opened the bandage, I saw a greenish deposit around the wound as if it is in the copper vessels. I thought, depending on the doctrine of signature, why we should not give cupramasticum itself. After giving cupramasticum, wound completely healed without any need for the grafting or even wound needed the stitches. From with the internal medicine, it has helped. So I say we have used cupramasticum, which is not indicated in your repertory at all.
Mm-hmm.
So which is a unique medicine which we have
Yes.
used.
And also there are so many other drugs that we haven't talked about. So as we started saying, these are general management, but based on your own case, and we need to select the medicines.
You may develop a different idea, as I told you in the cupramasticum, you may develop a different idea.
Yeah.
In one case of wound, which was a swollen lymphadenitis, suppurative lymphadenitis, where they wanted to do the surgery for an infant because of the appearance of the bubo. I have given Ignatia. Ignatia works on plague. In plague, you will see suppurated lymphadenitis, which are nothing but the buboes. In 2 days, there was no bubo. It got completely cleared.
First of all, I would never have thought of Ignatia for
which
but,
we will show you some of the photos.
Yes.
That you can go. You can
so
observe
there
that.
is a lot of merit in what
In
you're
system.
saying.
Yeah.
There's a lot of merit in law of signature,
Yes.
or how the
Doctrine
wound-
of signature.
doctrine,
You can prescribe on any method, not just mere repertorization method. You can prescribe on the basis of doctrine of signature. You can prescribe on the basis of appearance. Recently, I was showing one case to her where there was a ulcers at the edge of the tongue, where it was almost like a folding corrugated edges was there. Usually when there is a corrugated edge is there, you think of Merksal, thinking that it is an impression of the teeth.
Yeah.
But actually it was not the impression of the teeth. The tongue itself edges had become corrugated due to the ulcer. If you read Elysium, he says, appearance of the tongue like folds of the skin at the edge of the tongue with ulcer. After giving Elysium, patient has expressed that 80% of her complaints has come down, which was guided to an assistant doctor to treat the patient after seeing the appearance of the tongue, and the patient has expressed that she is completely relieved of the ulcers on the tongue. But before guiding this, the assistant doctor had tried acid nitric acid, mure, Merksal, everything. So here we have prescribed on the basis of the appearance. So on the basis of appearance, on the basis of natural order, on the basis of the allergy nature. In one case of a drumstick, there is a drumstick allergy. But we don't have the medicine made from drumstick. Because if you go towards in India South, Chennai, in most of the food items there will be drumstick. I told them, take a small piece of drumstick, add 2 drops of water, crush it well, add 1 drop of that water in half liter of water, shake it well for half a minute, then start taking 1 sip every half an hour. The allergy came round after with the repetition of 2-3 doses of the same material. So our system is which can cause can cure. We have seen even in allergy cases we have treated like this also. Any method, there are so many approaches to the prescription and to help your patients.
Just a note on Elysium, sir. I'll let them know. It's not to be found in Lotus Mitra Medica. It is not, you can find that in Clark.
Clark, sorry.
And we also had a look at it, the source of it. It's actually star aniseed, which is there in our kitchens most of the time. Thank you very, very much, sir,
You're
for a
welcome.
wonderful talk about wound management, and we'll bring you more on different topics. Stay tuned.